We're a group of people working within the NHS and at the Department of Health, and we are passionate about making sure services are linked and relate to the communities within which we serve. That might be nationally or locally. We need to make sure that we're relating to people out there, and we're using the intelligence from the information and feedback we get to inform either our policy work or our service delivery work.
I'm John James from the voluntary sector, and the Sickle Cell Society, which I run, is pledging to have 25 new sickle cell patients who are consistently engaged and involved with their local patient support group across the country. Now, why is that important? Well, it's important for all the reasons that Joan talked about earlier in terms of engagement, involvement, and leading to better experiences and outcomes for that group of patients. Sickle cell disease is a genetic but long-term condition, and it's been a neglected group in the past, and they deserve a good patient experience, and they deserve to be involved in policy and developments as we go forward.
I've been a bit greedy and I've had 2 pledges. So I'm Marie Gabriel, I'm chair at East London Foundation Trust, which is a mental health and community health services trust. And so as a board, what we're recognising is a link between frontline staff and patients, and how working together, that's how you're really going to get quality improvements in care, and sustainable and meaningful and relevant ones. So as a board, we've actually pledged to make sure that we have conversations on a weekly basis with frontline staff, to have conversations to see how we can further improve care. And as a chair, I pledge to see how we can ensure that we are able to have the patient voice at the board meeting. So it's actually making sure that those most marginalised, those voices that are most seldom heard, are actually right at the board meeting, at the heart of decision making. What we've done in our trust is spent the morning with staff from admin to consultants, actually saying, what are your pledges? And we will continue to make sure we have small pledges from our staff into the future, leading to big transformation.
I'm Barry Mussenden from the Department of Health, and as part of this collective of pledges, I pledge to promote equality and diversity within the department. We can sometimes be seen within Whitehall as a bit of a closed shop, so I want to actively work over the coming year to give opportunities for others to come inside the department, give them an idea about working in the department, to bring a bit more diversity into the place.
Following on from what Barry's just said, today my pledge was to go out into the community around Skipton House, which is one of our main offices for the Department of Health. It's a very diverse area, but we rarely venture out into the market, into the shopping centre, and my pledge was to give everyone a copy of the NHS Constitution and to talk to them about it on their terms. And the thing I learned, the thing that people were most enthralled with, was it was free. There was no cost. That just tells you something about the way people perceive what's happening in their lives. Everything is costly, but as health, we can relate to them by saying, it's a service, it's for you, here's what you're entitled to. And they were really happy to hear it. We need to do more of it.
As you've heard, our pledges are around the sort of equality and diversity theme, and that can be an area where there's a lot of lip service, but not necessarily a lot of action. So we've collectively pledged to come back together in 6 months to see how we're getting on and see how we can build on that and do better.
I think what's been really great about these pledges is that it's voluntary. This isn't part of performance management. We've seen people get excited about this. How can we make sure we keep the excitement going? It's going to be the test. And basically, as long as it's about patients, then I think we can keep that momentum going. So watch this space.